Hello all, and welcome to the bi-weekly webinar for September 7th, 2022. My name is Hannah McGahey, and I am the Workforce Coordinator with the Kansas Children's Cabinet and Trust Fund, and I'm being joined today by my colleague, Megan Broha. She'll be putting links in the chat and answering questions that come up. So today we've got a couple of things to go over with you. We've got a presentation about the Kansas Family Support Network. We also have a little advertisement for the family leadership team. We're looking for a family representative for that. And then also, if you're not aware, tomorrow is International Literacy Day. So just kind of going to give a high level overview of that. And as I said, so tomorrow is International Literacy Day, September 8th. And there's a lot of really great things going on globally, within Kansas, in the United States. If you just do a little bit of research, there's a lot of really incredible, especially STEM related innovations that are bringing literacy to children who are especially affected by conflict or COVID, many of the things that we know children are experiencing around the world right now. But I really love this video that was put out by UNESCO. So we're going to go ahead and watch it together.
Accelerated digital revolution and the COVID-19 crisis have taken a toll for millions of learners around the world. Globally, 771 million people, most of whom are women, still cannot read and write. An estimated 53% of 10-year-old children in low and middle-income countries are not able to read and understand a simple story. Historically, literacy learning has occurred outside of formal education spaces, within family, community, online, and in the workplace. Growth in such learning spaces has become more visible in response to the COVID-19 crisis. Embracing a variety of literacy learning spaces ensures the spaces are centric to the needs of youth and adults, giving them an opportunity for lifelong learning. In some countries, radios, TV, and SMS were used to broadcast educational programs, while in others, digital solutions were key to continue literacy learning throughout the pandemic. Even though online learning provided an opportunity to tackle these challenges, it also worsened educational inequalities, impacting the most marginalized. Worldwide, at least 31% of students couldn't be reached by digital and broadcast remote learning programs. As we slowly recover from the devastating learning loss of COVID-19, urgent action is needed to address the challenges of the right to learn. We must unleash the potential of literacy learning spaces so that they can be safe, inclusive, and resilient to leave no one behind. Efforts should be made to continue the positive trend in which literacy learning spaces expand the learning possibilities of all learners. Governments, policymakers, and stakeholders must keep up. They need to adapt to a fast-moving world and tackle global challenges to make sure these growing spaces are recognized. Together, let's transform literacy learning spaces to guarantee quality, equitable, and inclusive education for all.
So as I said, International Literacy Day was founded by UNESCO. It used to be World Literacy Day up until their 14th session in 1966. So the first year that we celebrated International Literacy Day was 1967. And the purpose is just to raise awareness about global literacy needs, specifically as they're impacted by significant events like war, famine, poverty, pandemics, etc. So based on information that was put out by the United Nations early this year, I believe February of this year, globally, 773 million adults and youth still cannot read. And then 617 million children and adolescents are not achieving those minimum proficiency levels in math and reading. So I think it's really, obviously, this is a very important issue. And for all of us that work in early childhood, we know how much this affects a child's quality of life and the trajectory of their life in general. So there's a lot of things that we can all do to encourage literacy. And specifically just to remember that a literacy environment is not just the classroom. It can be at home, it can be in, at the bus stop, it can be wherever a child's going to encounter that opportunity to learn and grow. And so one of the things that we're really proud of here in Kansas is that we are an affiliate of Dolly Parton's Imagination Library. As you guys know, the Kansas Children's Cabinet is the state sponsor for the Imagination Library. Not only is it a great resource to increase literacy on an individual level, so if you are somebody that has a child that's at that age where they're starting to be read to, or they're starting to show interest in books, I encourage you to follow the links that are going to be put in the chat and see if that child is eligible. And then secondly, if you're somebody that may represent an entity like a small business, a school district, a local foundation, or a community foundation, you could be eligible to become a local partner of the Dolly Parton Imagination Library. And what that does, if you go onto the Imagination Library website, you can look at a map of Kansas. We also have it on, it's actually on the Kansas Children's Cabinet website, but it shows all of the counties in Kansas and where children don't have access to the Imagination Library. And it's kind of unfortunate because those kids would be missing out on a free way to deliver literacy opportunities to them and to foster that positive experience of learning to read with your family, with your parents, your guardian, whoever it is that's providing that parental support. So follow the links. You can find out if you're eligible to participate, if your child is eligible to participate. If you're not, where the closest one would be, the closest location would be, and then also look and see if your county is one that doesn't have coverage, and maybe somebody that's interested in becoming a local partner or representing their entity to become a local partner. So a lot of really great opportunities there. And as always, I believe if you have questions about becoming a local partner, you can email Pam Hunsacker, and we have her email in the chat if you just got questions. We also linked sorry, I've got noise on my floor. We also linked an FAQ sheet about enrolling as a participant or as a sponsor. So if you have questions about that. And now I'm gonna go ahead and turn it over to our very supportive friend, Elise Dunnigan. She's gonna be giving us some information about the Kansas Family Support Network. So we're very excited to have her here today.
Thank you. Good afternoon. Thank you all for being here on your lunch hour. I appreciate you taking this time and giving me this space to share this information. My name's Elise Dunnigan. I'm the Family Resource Center community organizer for the Kansas Family Support Network. And today I'm going to talk a little bit about what a Family Resource Center is, the National Family Support Network, and our new Kansas Family Support Network. So we're really excited to be doing this work in Kansas, and I've loved learning about some of the locations, as you probably know, in a lot of your communities that are already doing this work. So as you guys think of questions as we go along, if you want to put those in the chat, kind of like a parking lot, and then we can get those to the end, that'd probably be the best way to do that. And I guess we can go ahead and get started on the next slide. Okay, so some of you may already know what a resource center is or a family resource center, and some of you, this may be a new concept. So what is a family resource center? Commonly referred to as America's best kept secret. If you watch any of the webinars on the National Family Support Network page, that's their favorite quote. Thousands of family resource centers have emerged throughout the country, largely under the radar. A family resource center is a community or school-based welcoming hub of support services designed to help families be strong and successful. Family resource centers work with an approach that is not only two-generational, but multi-generational, strengths-based, and family-centered. Family resource centers are always evaluating the needs of the community they serve in order to best meet the needs expressed by families, which makes them responsive and highly adaptable. Family resource centers are designed for all families, not just low income or highly challenged. So the support they provide is not stigmatized, making it accessible for everyone. And programs are typically provided at no cost or very low cost. So the family resource centers are really meant to be for everyone in the community. FRCs not only provide programs, but build communities of peer support and develop social connections to reduce isolation and stress. So a little bit about Family Resource Center history, and I expect there's probably a lot of social workers here, so you've probably heard about this in the intro to social work class at some point in time, but the establishment of settlement houses in major metropolitan areas in the late 1800s was to support the large number of immigrants entering the United States. By definition, a settlement house was an institution providing various services to the community. In many instances, settlement houses provided support for residents, job training, English classes, and social advocacy as a means to assist them in understanding, adapting to, and succeeding in American society. So on the left, you'll see the Good Samaritan Settlement House in San Francisco in 1913. And on the right is the Good Samaritan Family Resource Center today. So founded in 1894, the Good Samaritan Family Resource Center prides itself on partnering with immigrants in search of opportunity. Good Samaritan's founders were inspired by the Whole House, which was launched in 1889 in Chicago by pioneering social worker Jane Addams. And Addams acted when a growing number of European immigrants, including children, began to live in poverty in the industrial sections of the city. So in its heyday, the Whole House in Chicago offered thousands of newcomers a public kitchen, job leads, boarding rooms, kindergarten classes, supervised children's activities, courses for the unemployed to learn new job skills, and their say in forging their future. Much of this model lives on today at the Good Samaritan and throughout the country in the framework of family resource centers. So family resource centers have a very long history in this country. Okay, next slide. Thank you. So looking at family resource centers across the country, family resource centers can look very different from state to state, community to community, and take many different forms. They may be a freestanding building in a school, office building, or may have no building at all, just be a network of resources. The things that all FRCs have in common is that they provide, again, that programming at no cost or very low cost and across the spectrum for all families and for all ages on a multi-generational level. So some examples of ones in these pictures, the one up to in the right-hand corner, that is in Kentucky. And in Kentucky, most of their family resource centers are operated out of schools. So they do mostly school-based family resource centers. The one on the left, and if you've ever been to Maine, I've been there. It's a very Maine-looking house. That's the Maine Family Resource Center, that cute little yellow house. And then the two down below are just a couple other examples of like a storefront. It looks like there's some apartments above it. But some, like I was saying, you don't have to have a building whatsoever. So the Pittsburgh Family Resource Center in Pittsburgh, Kansas, they're kind of a resource of agencies that come together, and there's not necessarily like one building for all the resources. Some other examples in Kansas are the Kennedy Learning Center in Lawrence. Marysville has an amazing family resource center, the Pony Express Partnership, if any of you know about that. So those are some examples in Kansas, but there's all kinds of examples across the country. They like to say if you've seen one family resource center, you've seen one family resource center, because none of them are the same. So next one. Okay, so as conveniently local hubs of support, family resource centers bundle and co-locate many services that may be familiar to you. I'm sure most of these are familiar to all of you. Home visiting, health screenings, child care resource and referral, play groups, fatherhood programs, emergency assistance, food banks, family counseling, job skills training, parenting classes. Um, you may have fatherhood initiatives. Um, again, just access to all kinds of resources, parent leadership development, other kinds of family economic success activities, and maybe other health and wellness activities. So again, no two family resource centers should be tailored to the community and the community's needs. So no two are going to look exactly the same. So family resource centers not only provide programming and resources, but they build community and peer support and develop social connections to reduce isolation and stress, which are highly correlated to the rates of child abuse in communities. And I think during COVID, it became clear and it just really became how apparent local support and access to local resources are for families. So I think that's kind of where I know I hadn't heard about family resources at resource centers as much as I had prior to doing this work. And it seems like you're hearing a lot about them now. So I think the pandemic is why. So next one. Okay, so talking about the impact of family resource centers. So there have been studies done that have shown some of the significant impacts that have been made. In some states, FRCs partner with local child welfare jurisdictions to prevent maltreatment across the child welfare continuum, from providing primary prevention services to serving families who have been screened out of child welfare to supporting families with open child welfare cases and post reunification. The majority of the cases include neglect, which often results from challenges accessing key resources such as food, clothing, shelter, medical care, or child care. A core FRC service is connecting families to these vital resources in their community. Family resource centers increase protective factors for children's safety, and programs delivered by FRCs can reduce subsequent family involvement with the child welfare system. So in neighborhoods, they found that in neighborhoods with family support centers, those neighborhoods had a 26% lower rate of child abuse and neglect investigations than similar neighborhoods without them. And I'm sure most of you have either or taken or heard of like the mandated supporting versus mandated reporting. And I think that's where the mandated supporting comes in, is families, when you can help fulfill their needs with these resources, such as lack of housing, clothing, food, et cetera, then those numbers look a lot different. So, okay. And an example of one of these communities is Teller County, Colorado, is outside of Colorado Springs. It's kind of a mix of rural and a little bit of urban. And they did a large study in that county. And since Teller County, Colorado moved to a differential response model in 2016 that utilizes family resource centers, the child abuse rate had a 63% reduction rate, which is huge. And they have one family resource center in that entire county. And then as far as this one talks a little bit about the financial piece. Child maltreatment affects at least 1 in every 7 children in the United States annually. And in 2015, the estimated cost of child abuse and neglect across the country was $428 billion. So for every $1 invested in an FRC in 2018, the Teller County, Colorado child welfare system saved $2.92, which totaled over $2.5 million. And then for every $1 invested in an FRC in Orange County, California, they found that they saved $3.65, totaling 1.1 million in 2016 and 1.8 million in 2017. So not only is there a money saving with FRCs providing resources and supporting and connecting families, which is huge because obviously we can use that money, put that money into other things, but also the human costs that we're not putting, the children aren't entering the child welfare system, causing further trauma, causing, and that kind of creates an avalanche of other issues. So, all right. So I'm going to talk a little bit now about the National Family Support Network. It was founded in 2011. And it's the United States membership of organizations for state networks of family resource centers. Its mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state networks and championing quality family support and strengthening practices and policies. So they have a wealth of, like, if you're interested in learning more about family resource centers or what family resource centers look like in urban centers versus rural areas, they have all kinds of resources on their website. And if you cannot find what you're looking for, by all means, like, email or call me and we can work on that together. So, but I encourage you to look at this website. They do have Wednesday webinars a couple times a month. And if it conflicts with your schedule, they also record all of those, and you can just, whenever time allows, you can watch those webinars. So the vision for the National Family Support Network is a nation in which every family is thriving and every state has a strong and effective family support and strengthening network. And this is a little bit about, like, how many states are involved. The National Family Support Network, again, it was founded in 2011. And at the time that they founded, they had 8 state networks as membership organizations. Today, it's grown to 38 member networks of more than 3,000 family resource centers. Kansas is one of the most recent states to join the NFSN, and we are considered an emerging network because we're brand new. And the newest member, 2022, I think, is North Carolina. So, but we also have, there's over 3,000 family resource centers, and I haven't seen that number change recently. So I think that number is probably much, much higher. It's just with all the new networks, I know in the last year, it's probably difficult for them to quantify that. So talking a little bit about our local Kansas Family Support Network. We are, Kansas Children's Service League is proud to coordinate the Kansas Family Support Network, which is a member of the National Family Support Network. We founded, the Kansas Family Support Network was founded in October of 2021, so less than a year ago. And we provide certification training across the state and support the development, growth, and continuation of services by providing technical assistance, training, advocacy, and networking opportunities. We held our first standards training in March of 2022 and have had 4 individuals trained as trainers. We had our first Kansas-led Standards of Quality for Strengthening and Support certification training in July of 2022. And so far, just with 2 trainings, we've trained almost 50 individuals from various organizations throughout the state of Kansas. So we're very excited about this work moving forward and what Kansas will do. So the mission of the Kansas Family Support Network is to support the development, growth, and continuation of these services by providing technical assistance, training, advocacy, resources, and networking opportunities. So KCSL is the DCF grantee providing support, technical and certification support to Kansas Family Resource Centers as the Prevent Child Abuse America chapter for Kansas. So currently, the Kansas Family Support Network is providing training and technical assistance, again, resources, collaboration, access to member events and training in the standards, which provides a common language and delivery of services. So our network is just emerging, as I said before, and we've started conducting some surveys of various family resource centers in the state, and have kind of been trying to feel out who has interest and what family resource centers are already existing. And I mentioned some earlier. There's more in the state, but those are just a few examples of some of the family resources centers throughout the state. So a lot of people ask about what the training is that we provide. And this training was created through or by the National Family Support Network. So on the national level, and Kansas has 4 trainers, excuse me, 4 trainers that do this training in our state. I call it the standards because the long name is Standards of Quality for Family Strengthening and Support Certification. So I think you understand why we shorten that. The nationally adopted standards are designed to be used by all family strengthening and support stakeholders. So public departments, foundations, community-based organizations, and families as a tool for planning, providing, and assessing services. The vision is that their implementation will help ensure that families are supported and strengthened through quality practice. The standards create a common language and expectations in the family support and strengthening field across the different kinds of programs, such as family resource centers, home visiting programs, and child development programs. Beyond the common language are implementation tools that have been designed to support effective implementation of the standards. So the program self-assessment tool to be used by program managers and supervisors, the staff self-reflection checklist to be used by staff members, and then the participant survey to be used by program participants to evaluate the program. And that's a part of that ongoing, not only evaluation, but evolution of family resource centers, because maybe we've had this program in place, but now there's a new need in the community. And that's how we, hopefully those family resource centers are getting that information and implementing it. Completion of the standards training is a requirement for becoming part of the Kansas Family Support Network. The training is a day and a half. Right now, all of the trainings are by Zoom. They are interactive, and right now the trainings are at no cost to participants for this year at least. So it's a good time to get the training if any of you are interested. And so I wanted to share some of the upcoming training dates. We have one coming up in a couple weeks, and there are still a few spots. Those trainings are capped at 36 participants, so we can't do a lot for every training. But so if you are interested, like email me as soon as you can. And then we have one in October on the 4th and 5th, and November 29th and 30th. So yeah, just contact me and I can send you a registration link. This quote, I really resonated with me when thinking about the work that family resource centers do. That children don't grow up in programs, they grow up in families and communities. So I just wanted to share that when kind of ending. And I think this work is really exciting. It's really going to benefit everyone. And whether you're in an urban area or a rural area, there is I'm sure some of you may be aware, but DCF has released an RFP for family resource centers, and that's due on 9/16. So just FYI, if you weren't aware of that, you can check that out on the DCF website. And I can answer any questions that anyone has now, I guess.
Regarding the DCF, is it a grant opportunity?
Yes.
Okay, so they're trying to facilitate the production of more FRCs throughout the state.
Yes, it can be a current, as I understand it, it can be a current already operating family resource center or someone who's, starting up. So
very cool. I'll look into that. We'll make sure that we include that for our next webinar, and I will be quiet and check the chat for comments now. I was curious, I know that some other models, programs, etc., there's age restrictions. So would a family resource center be an appropriate avenue for a family, maybe with a child that's aged out but still requiring additional supports, or are there age restrictions?
No, the family resource centers are meant to be multi-generational. So even though, your family resource center may be in a school and that's where you might go to get information, they may not serve every generation or every age in that at the school, obviously, but they can give resources to that family of where they can, go to get those resources or what that resource is. So like for a child aging out of foster care and going to, and, help for, who to talk to as far as who's your independent living, connection, what are some other resources for children that have aged out of foster care, things like that. So they don't necessarily have to have all those resources in-house. And again, they may not even have a physical location, but just be able to guide families and individuals to where they would get those resources at.
So I'm also a little bit curious, if I was a person that went ahead and completed that training, and I wanted to become part of the network, what are some of the activities that I would be engaging in, or the things that I would be doing as part of that network?
So right now, because we're so new, we're really focusing on training, just getting people trained and getting them into those trainings. But what we plan to do in the coming year is to have quarterly meetings for members, hopefully offer other training opportunities for members, to also offer technical assistance for people that are, interested in starting FRCs in their communities and assisting them with that. Kind of hopefully having a newsletter, or sending out information by email like you all do for your group. So there's kind of, those are our plans for the future. But right now we're really focusing on the training aspect, since we've had 2 trainings so far. So that's our primary focus.
Perfect. And then I'm also wondering, are most referrals then self-directed? Is it a family that's actually connecting to the Family Resource Center, or is it appropriate for other agencies to refer a family and connect them to the resources there? What's the typical route?
I think both. In different states and throughout different communities, it varies. Because I think if you're talking about like mandated supporting versus the mandated reporting, like if we look at that, and a family is someone makes a report and it's not an abuse report, but it's these children don't seem like they have enough to eat, and the mom seems engaged at school but the kids seem hungry, then maybe that's referral to the Family Resource Center to see about food banks and what other needs the family has, and just to kind of put them in contact with those resources to meet those families' needs. So it could be that that person doesn't make a report and just reaches out to the family like, hey, have you heard about this resource center? Or it may be a report is made and then DCF routes the family to the Family Resource Center. So it could be either way. And again, in some communities and in some states, like I said earlier, they actually, like the family resources are almost like the front line, you know, where when they get those reports, they're engaged and they work closely with them to get those families connected to resources.
That's incredible. I love hearing about just the nuances that exist between states and how, you know, it's got to be responsive to what that community needs. Well, thank you very, very much for being here with us and telling us all about this great new opportunity that's taking place. I see that in the chat, we've got more information about that grant opportunity. So Nikki from DCF advises, yes, the DCF Family Resource Center RFP is open until 9/16. So if you're interested in that grant opportunity, as Elise said, either as an existing Family Resource Center or you're just interested, check out that link that Nikki dropped in the chat. Thank you, Nikki. And thank you to Elise. And we will continue to monitor the chat if there's any other questions that come up. Oh, where is the Family Resource Center in Kansas? Now, so the KCSL one, it is where, Elise, the one that you're working with?
Well, KCSL, we're the grantee from DCF to provide these trainings and the technical assistance piece. So we are, you know, the Kansas Family Support Network kind of spearheading that and getting that training out and the technical assistance out to the state, versus like the family resource centers. I mean, I know some of various ones in different communities, and KCSL and Topeka, some different places offer a lot of these opportunities, but Pittsburgh, Kansas has a network. They actually, the Pittsburgh Family Resource Center, there isn't a list. I just saw that. Hopefully, like in the future, that's something that we will be able to develop and give out as a resource. Again, we're kind of just getting started and with this work, and mostly trying to get people trained and kind of get everyone connected. The Lawrence Kennedy Learning Center in Marysville is a great example of a family resource center as well, with the Pony Express, I think it's Pony Express Partnership for Children. So what the training is for. Okay. So the training of the standards of quality for family strengthening and support certification is a overview of, it looks at the 5 protective factors. It looks at DEI. It looks at evaluation. As a former supervisor, like the evaluation piece was really, like, that was the part that really sparked my interest, like as far as, and I think for administrators, the program evaluation piece may be more interesting. And then like for new staff that maybe haven't been a home visitor before, then the part about the 5 protective factors and the, you know, maybe the more important piece, but it goes over all of that. So, and it really creates a common language that we can all use that was developed on a national level. So, and just to really create like a quality of a standard of quality for all family resource centers. So we're all operating off of the same information.
So would it be, I'm trying to make sure that we're all clear about the purpose here. So would the purpose of the training be for somebody who's already employed or working with a potential or existing family resource center?
Yes.
Okay.
Yes.
Hopefully that cleared that up.
So I have a question. It might be easier to ask. Can I do it verbally?
Yeah.
Of course.
So I coordinate a Parents as Teachers program, and we do a lot of this type of work in home visiting.
Mhm.
But we are not a family resource center, but our whole job is to connect families to resources. So in some regard, we function that way. So I
Mhm.
guess what is the connection between us and this model of the family resource center? Does that question make sense?
Kind of, and I'll try to answer that, and then you tell me if I've got it or not.
Okay,
So,
thanks.
um, so yes, I think a lot of home visiting programs operate as family resource centers because you are there to give resources to the family. I think the key piece is looking at on the evaluation side, like, are you multi-generational? Like, are you also, say there's grandma living in the house and she needs to sign up for, she doesn't have insurance and has health problems, like, here's a resource to help grandma as well. Are you bringing that information out as well? So that would be the piece that I would question. Like, are you serving the entire family on a multi-generational level?
Yeah, our curriculum changed. I want to say now it's been almost 10 years ago from being a child-centered program to a family-focused approach, because we know that kids don't develop in a bubble, they develop in a family
Right.
system. And so our approach truly is to, make sure that the family has the resources it needs so that they can then show up for their child, so whether that's helping connect them to, like you said, housing, food, job, assistance, all of that sort of thing. So I feel like you said, it's like, I almost feel like we're our own little resource
Yes.
center. And so at that point, I guess my question is, then would the grant be an opportunity that we could write for? And also, is that then this training would be most appropriate for like the coordinator level person in that organization?
So as far as your first question on the grant piece, I can't really answer many questions about the grant, but I would encourage you to read it over. I do know you have to be a 501c3, so I don't know if your organization fits into that or not, for this particular grant through DCF. And the second part of your question, now I just lost it.
Would it be for the coordinator to go through the
Oh,
training, or for parent educators that are actually out in the field?
yes. So we've had a lot of discussion about that because the National Family Support Network says this is for grantees, grantors, like other funders, for frontline staff, for admin staff. And I think this is important definitely for your home visitors, for the people that are actually going out and meeting with families, because it provides that foundation for them. But then as a supervisor, obviously you want to make sure, if you're the one looking at that evaluation piece, like, are we meeting the needs of our families? It's important for a supervisor level to, your supervisors to go out as well. And I think the problem when you get up higher, like in a director level, is I know it's hard to find a day and a half to go to a training. I totally understand that. So I guess if they're not able to, like, how will you disseminate that information? Like, from just making sure everyone is on the same page with the information you're receiving. But yes, it's appropriate for every level of your organization.
Thank you.
Uh-huh.
Thank you for that, Michelle. And as somebody that sits on the home visiting leadership team, and I get to experience that quite a bit, it's really great to hear all of the different home visiting models and the way that tools like that are able to reach and serve families. And so it's really exciting to hear now also about the family resource centers. And I think that we all know that the demographics of Kansas are, incredibly different depending on where you're at in the state, the strengths of that community, and how people find information, who they trust and who they rely on. So I'm personally excited that we have one more great way to connect our youngest Kansas to services and resources within their community. It's going to help their quality of life. So this is really fantastic. I will look and see if there's any way that we can share more information about that grant opportunity, and just thanks again to Elise for coming in and sharing information with us. So we appreciate you.
Thank you.
Another great engagement opportunity, if you guys are interested, and kind of on the same vein, is the family leadership team. So 2022, 2023 is kicking off Thursday for the family leadership team. The purpose of the family leadership team is to inform, support, develop, and then advise on issues and initiatives that engage families to influence and enable systems level change. So all of that to say, it's getting people in the room with state and community leaders who oversee efforts that affect families in Kansas. It's comprised ideally by at least half of the participants being actual family representatives. So really important to have these conversations that are systems level with users and experts at the same time. So you can see here kind of the purpose and vision of the family leadership team. But the purpose of me talking to you about it is I'm looking for somebody that's interested in joining the FLT for 2022-23. So I, Hannah, let me go back real quick. I am the state or community leader representing the Kansas Children's Cabinet and Trust Fund, but I need to have a partner that is a family representative. And so what I'm looking for, if you're interested, is somebody that would want to join this and do this with me throughout the year. I believe it's a monthly meeting. The first one's like an hour and a half, so it's kind of reasonable. I will say it's during the day, so that may be a problem. Here are some of the eligibility requirements. And it's okay if you wear another hat, you know, in a different world, I could also be this person, you know, based on another hat that I wear. So if this looks appealing to you, if you're somebody that's really passionate about that parental voice or that family voice, and you fit these parameters, and you just kind of find yourself in these advocacy positions, whether that's the conversations that you participate in or the way that you know, kind of spend your spare time and you're just naturally motivated to make change, I would love to work with you this year and do this together. So if you're interested, you can email me and we can talk more about the expectations. Like I said, I think it's a once a month meeting, but really, really unique ability to get in on the ground floor on some of these big conversations that state and community leaders are having that, you know, could really affect you and your family. So if you're interested, email me and we can talk more. All right, so reminders and next steps. We've got another webinar coming up. It'll be 2 weeks from today, Wednesday, same time. If you're already registered for this one, then you will have your registration link for the next one. As always, if you are willing to come and share maybe something cool that your agency is doing, something innovative, something new, or just a project that's going really, really well, especially if it's part of the strategic plan or PDG, we would always love to hear about it. You can pop on for 5 minutes or 45 and make my life really easy either way. Our next early childhood recommendations panel meeting is September 16th. That's next Friday. All open forum comments are need to be delivered to me at the same email by Thursday, 5 p.m. prior to that Friday meeting. As always, that panel meeting is live streamed on our YouTube channel. And then finally, October 7th, we have our Kansas Children's Cabinet and Trust Fund meeting in the morning, and then the early childhood meeting in the afternoon. So if you haven't registered for any of these, we've got links in the chat that you can do that. And that is all that we have for you today. Really excited. Enjoy your literacy day tomorrow and read a book with a child. That is your task. So enjoy the rest of your Wednesday and we'll see you in 2 weeks.
Thanks, Hannah. See you, everybody.
Bye, guys.